Hey class, this is Ashley Tharp, and today we're going to be talking about the mental status exam and how it's an integral and essential portion of the psychiatric eval. The mental status exam is a structured way of observing and describing a patient's current state of mind. There's about 12 domains on the MSE, but we're only going to talk about 3 of those 12 today, which is appearance, behavior, and speech. So when we talk about the appearance of a patient, we're going to look at the general overall appearance. What does this patient look like at rest? When they came into the interview, what was their gait like? We want to look for any distinguishing features. We also want to look at their age and their gender. Do they seem younger or older than their stated age? That can give an indication or clue into a mental health disorder such as substance use. What is their body type? Are they underweight? Are they overweight? Is there any disease presenting in front of you? So like the color of their skin, do they look jaundiced, which could indicate maybe alcohol use or alcohol abuse disorder? What kind of clothing are they wearing? Is this appropriate for the season and the time? What's their hygiene? So do they have an odor about them? If they do have an odor, what does it smell like? Their grooming. So do they seem well dressed or well put together, or do they seem disheveled and unkempt? This can kind of give you an idea of maybe their ability to take care of themselves. Any physical abnormalities, so again, looking for discerning features. Pupil size, that might give you an indication of maybe opiate use or substance use disorders. Any bruises, needle marks, track marks, things of that nature. Bruises can be indicating of maybe some violence that the patient has suffered. Any cuts, any tattoos, body piercings, scars, etc. You also want to look at their teeth. That's a good indicator for some substance use. You want to look to see if they brought anything with them. The next thing you want to look at is their behavior. So this is the patient in action. How are they interacting with you during this interview? What's their posture like? What's their eye contact like? Are they engaging? Are you able to develop a rapport? If they appear distracted, or do they seem to be engaging in some type of hallucinations? This could be an indicating of like schizophrenia. Again, facial expressions. Do they seem relaxed? Are they angry? Are they disengaged? We want to look at their body language. So do they seem, with their nonverbal cues, do they seem open to the conversation, or are they kind of closed and guarded and maybe withdrawn into themselves? You want to know any exaggerated gestures or mannerisms. We also want to look at psychomotor activity. So this is there a delay in their response to your questions? Is the patient fidgety? Are they pacing around the room? Refuse to sit still? Or are they just sitting there quietly and calmly and having an engaging conversation with you? We also want to look for abnormal movements or postures. So these would be involuntary movements, tremors, tics, smacking their lips repetitively, rocking, hand flapping, clearing their throat. And then we also want to look at their speech. So we want to see the quality, the rate, the fluency, the volume or tone, and articulation and accents. So the rate of the patient's speech is often indicating of some maybe mania or hypomania, some flight of ideas. So we want to see, is it pressured? Is it rapid? Is it regular? Is it slowed? What's the cadence to the rhythm of their conversations? Are they able to make small talk with you? Is there any stuttering or stammering that would indicate impaction to their articulation? Is there an accent? And do they have trouble with forming words, the mechanics of words? Is there repetitive words said back that reflect the interviewer's words? So that would be indicating of echolalia, which often you see in autism disorders. Or is the patient making up new words? These are all very important things to consider when doing a MSE. Thanks.